Okay, hello. I am just doing a really quick check-in with you guys after another day post-op. I'm happy to report that the pain from my surgery has gone way down. And I just noticed like discomfort from my steroid drops, but it's much less than it was before. Everything is a lot easier right now, which I'm super grateful for. And like, I feel like the epithelial level of skin is going to grow back pretty quickly. Right now, what I could say is like, just looking at my eye, I had surgery on this eye. This eye was left alone. I had surgery on this eye, and like looking at it, the redness is pretty much gone. The like grittiness is still there, but overall it's not too bad. Hold on. But yeah, overall it's not too bad. There's just like a sensation that there's something in my eye right now, but I know there isn't, so it's just important not to rub it at the moment. As you can see, the swelling has pretty much gone back to normal, but it's going to be really important for me to continue to take my steroid drops every day, 4 times a day, and to take my antibiotic drops 4 times a day, every day until 7 days. At 7 days, I drop off the antibiotic and I just stick with the steroid drop. And I do those 4 times a day for another week, then 3 times a day for a week, then 2 times a day for a week, and then 1 time a day for a week. So we're going to be on that for about a month, a little over a month. But it's slowly coming to an end, which I'm very excited about. You can kind of see the gunk on my eyelid. That is from the steroid drop. Not my favorite side effect, but honestly, not the worst it could be. So yeah, the overall experience so far of the corneal cross-linking procedure has been not too scary. After the surgery itself was really scary. But like the process of healing afterward has just been taking it day by day, and really being just patient with my body. Right now, like just looking through this eye, it's like looking through frosted glass. So like everything is super duper blurry, although throughout the day it's been slowly, when I say slowly, I mean slowly improving. But I can see shapes of things, but everything feels like it's an undisclosed distance away. Like I can't tell how far close anything is unless it's like right here, which is a little bit weird. And hello to those of you who are new. I'm just checking in after my corneal cross-linking surgery, which I had to treat my keratoconus, which I just got diagnosed with in December. It's like a sort of rare condition that affects the cornea, where usually you have like a nice dome shape, and now I have like this cone shape to my cornea. They went in and they scraped off the epithelial cells, and like cleaned off the skin, creating like an abrasion, and then bathed my cornea in riboflavin, hit it with a UV light, and the whole procedure took about an hour, a little over an hour. It was a lot psychologically. It was very scary. And the healing process has been not so scary at all, but very painful in the first 2 days, and then slowly tapering off, which has been nice. And I fully encourage people to make friends, I guess. I'm not sure if I understand that comment, but yeah, so I am coming on live to share this because I noticed that YouTube has a lot of videos from doctors and a lot of like pre-made videos that talk about the procedure, but not a lot of videos that show what it feels like to go through the healing process on a day-to-day basis after corneal cross-linking. Hi, Jasmine Head. Hey, it's been a while. Good to see you. Welcome, penguins. Welcome, little penguins. Thank you for subscribing. Glad to have you. But yeah, the whole process I feel like is something that like you can make a video about, and I will. But I just thought it would be really important to share the experience live. Because looking back, if somebody is going through this, it'll be good for them to be able to search and hear someone just kind of off the cuff talk about their experience. And so that's what this is for. It's not going to be a super long check-in. My day is going pretty well, Jasmine. I am dealing with recovery from corneal cross-linking surgery, which is like a pretty minimally invasive procedure, but like psychologically with a lot. And like the healing process is actually the hardest part because you have to wait for the skin cells that used to be on top of your cornea to grow back in order to see. So like right now, I can't see I can't read the comments with just my left eye. I can't even see the detail of my eye. It's all very, very fuzzy, like frosted glass. I love penguins. Penguins are adorable. But they're also messy and not the nicest. So, you know, it depends on how you evaluate them, whether or not you'll love a penguin or not. But as far as like cuteness, they're very cute. I love penguins and I love cartoon penguins. So I love your profile picture, especially. It's so cute. But yeah, Jasmine, that's kind of where I'm coming from. And like, I have been taking... Hi, Sebe Babe. Yes, I'm so glad that we have penguin lovers in the chat. But yeah, the surgery is done, which I'm very glad about. And I am happy to be healing up, to be spending some time with my daughter. My family has been in and helping me out, because like I said, I can only kind of see. It's a really weird thing, to only be able to see some things with my left eye, but I can see pretty clearly with my right eye, which is how it should be. I'm just exhausted from the process, but catching up on sleep. I didn't have to take much pain medicine. I only took it twice throughout the whole process, which is pretty nice. And other than that, I've just been taking artificial tear drops and the antibacterial or antibiotic, excuse me, and the what do you call it? The antibiotics drops and the steroid drops. So doing pretty good. Doing pretty good. Just had my dinner, took my last drops for the night. I always put on an eye shield at the end of the night. As a reminder, it's like this clear little doodad that I put on, and I have some tape that I use to secure it to my face. So I put this at the bridge of my nose like this, and then I find a good spot for it that, you know, my eyelashes won't like bang into it too hard, although my eyelashes touch it all the time, which is pretty annoying. But I just sort of smush them back and they stay in place. I can't wait to stop sleeping in this because it is super annoying to have something touching my eyelashes all night. All right, I'm just gonna stick this on the top and put this up here to where it's gonna go. And then it goes like that. And then I do the next piece of tape. do it across the bottom like this. And I'm actually going to shorten that because we don't need that much tape. Put this right here in the corner. And then another little piece. Pop this right here down the bridge of my nose. I'm going to get this piece off like that. And I guess I could do another piece down here. But this is really it. You know, I can actually place that a little bit lower. Yep. You know what? I don't even think I need that last piece of tape. I'm just gonna toss it. But yeah, this is how I get ready for nighttime. And then I put this mask on over it, just so that my daughter doesn't get too curious. I can keep it like this, and until I'm ready to fully go to sleep, I just pop these on, and that's really it. The sunglasses are because my eyes are still very light sensitive, but it's not as bad as the first few days where my eyes were super light sensitive, which is nice. I can definitely say that I see a little bit better. It's a little bit more comfortable. As far as the light is concerned, but like I said, the visual situation is just like I can't really see much of anything at all. It's just ever so slightly better than the day after my surgery, which was to be expected. But yeah, I'm really happy with the work that my surgeon did. I think she did an amazing job. But the thing is, like, I don't feel like it was a crazy difficult challenge for her because she's done so many of the procedure that I got. So she knew exactly what we were going to do. She walked me through it really simply, and I felt like I was in good hands the whole time. So now it's just a matter of watching the healing process over time, and seeing the way that things unfold. I'm sure that the healing process is more likely going to be like a 3-month process for me, where most of my vision I should have back by 1 month, but it will take another 2 months most likely to really see what my vision is going to be like. And then from there, I will be able to get new lenses, talk to my surgeon about my other eye, see like what else is going to be necessary to do, because it really is like a big process, with a lot to consider. So I'm definitely looking forward to learning what they say about, you know, what else I might be able to do as far as treatment. But I think I'm probably just going to be in scleral lenses, really for the rest of my life, which is just a strange thing to think about. I didn't mind when it was like glasses for the rest of my life, but the idea of sclerals and the idea that I'll never see any better naturally is pretty sad. Before I knew about my diagnosis, I always thought that there would be a surgery that they could do that could, you know, repair my vision. But knowing that my vision is pretty much set in stone is a hard one to swallow, but I'm getting through it.
Hello. There's a chance that Uncle Aaron might call your phone instead of Nana's because I think that's what Jen said. Because he's still coming here, but we just don't know when.
Oh, okay. Cool.
Just letting you know.
Thanks.
I don't know if you had your phone or anything.
I appreciate it. I have my phone. I'm just streaming.
Okay.
Alrighty.
I
love you.
love you too.
But yeah, that's pretty much the deal here. Like I said, I'm here with my family, just going through the healing process and knowing that everything is gonna maybe take a little while, but I should be back to my crappy vision real soon. And then I will ruin my good eye for a few months, which is going to be a chore. That's going to be a challenge. I'm not looking forward to that at all. And I want to see, you know, what this process of healing looks like first before I get too comfortable one way or the other. Because my left eye will be kind of my way of knowing whether or not I'm really willing to go through this before observing my right eye. But I understand that I'm also in like a pretty severe position. Like my disease has gotten pretty far. So there's always the risk of losing even more sight. And I don't really want that to happen, obviously. So, you know, we'll see. The good news is that the astigmatism in my right eye is not as severe as the one in my left. So anything can happen. Anything is possible. And I'm really just leaving it up to, you know, the opinions of experts in the field. But I wanted to check in and just say, hey, this is what corneal cross-linking surgery recovery looks like. I'm really excited that my eye is not as like inflamed as it used to be. It's really a good sign and a good show that like the healing process has begun. And I look forward to seeing the changes every day until I go for my 1 week appointment. I'll continue to check in with you all, just so that you have a good idea of like how things are going. And yeah, that's really it for me for here for now. But I will be back real soon tomorrow, most likely, just to talk a little bit more about corneal cross-linking recovery, and you know, hopefully attract anyone else who is going through corneal cross-linking, because it is a big part of a person's transformation to find out that you have a chronic and progressive disease that has permanent damage associated with it. And my hope is that by showing this video to people, by showing up online live, that we'll be able to help increase awareness and get people to a place where they feel empowered and like they are going to be all right. So, yeah, that's about it for me. I'll be right back because I'm pretty sure my mom's trying to talk to me from across the room and she's not going to be able to hear me. Those are your number one Chinese. Cool. Yeah. The bag is in there. But yeah, my mom wanted to know what Chinese restaurant I had ordered from yesterday. So I was trying to make sure she knew where I got the good food from. But yeah, guys, I will be back tomorrow. I hope to see you there. If you know someone who's dealing with keratoconus, or you know people who talk about eye injuries such as corneal ectasia, then please send them this way, because I feel like there are just so many of us who could benefit from each other's knowledge and experience. And I want to share my experience with others, so that they can make informed decisions. Because yes, you want to hear from your doctors. Obviously, you want to treat any disease that you have based on their input and their insights. But I think the other really important thing is making sure that when it comes to making a decision about a procedure, you also hear from people who've been through it. So you come in with a clear idea of what the experience is going to be like for you. Because, like I said, the surgery itself physically was easy, but the psychological element of like sitting there with your eye open, you can't look away, seeing all of the implements, it was terrifying. It was really rough. So I would want to have known that before I made the decision, not because I would have changed my mind, but because, you know, it's just important to go in with a clear idea of what it's going to be like and really think your way through that. And just, you know, find a way to be comfortable with something that's going to ultimately be very uncomfortable, I'll be honest. But the recovery, I would say, it's not like LASIK where like you see great and you're good and yay right at the end. Like you're gonna see like crap if you see it all, other than the light. I had like a fully opaque, couldn't see much of anything through my left eye, and I didn't even bother trying. I had really bad inflammation, so my eyelid was like kind of droopy over my eye, and like it just was really hard to keep my eyes open. That first day was rough. And then the day after, I was still feeling that inflammation and it was still pretty intense. But I think I've turned a physical corner on the healing process, and now is patience with not being able to see out of my left eye very well. And again, really looking like through frosted glass for the next month or so. I know it's going to be okay. Even if I don't get such great vision, like the surgery was important, and it's a stabilizing factor for keratoconus. Leaving it alone was not a safe choice for me. And so I'm just trying to have peace with that reality and know that, you know, there are other professionals who can take a look at my topography after, but I needed to do the safest choice for me for now. And hopefully, if there's an amazing, you know, miracle treatment in the future, I'll be eligible. But if not, at least I haven't lost any more vision. I can share my story with other people. And yeah, I think that's like the most important thing that I could do out of all of it. So thanks for hanging with me. If you want to hang with me some more, go ahead and subscribe. I'm here a lot. I've been away because I was finding out about this disease. There was the holidays, and like a lot was going on. But now I am checking back in with you all, and being more consistent because there's another thing to document, another big change. So yeah. If you want to hang out with me, feel free to subscribe. I'm here pretty often, and I plan to continue to come through as I learn new things about my condition, and I will be posting videos as well as coming on live, so check those out. I'm going to make a video that's just about like this experience of going through corneal cross-linking, and what it has felt like from my position as a patient, and I hope that it helps you all to like go through whatever it is that you're going through, even if it's just giving you something to think about that isn't your own situation. And then I hope that it distracts you from whatever you're dealing with. Yeah, all right. With that, I'm gonna go. I'm watching Columbo on Peacock, so I'm gonna go and watch that for a bit, and then I'm gonna go to sleep. It's so early, but I've been going to bed pretty early lately, just laying in bed with the dark. And I'm gonna give myself a little bit of a eye break. Hello, sweetie Petey. I'm I'm online. I'm streaming.
Streaming?
Yeah.
Really? No. Okay.
Okay. Hi, sweetie.
Hi, Mommy.
Hi.
Hi, Noni. Hi, Noni.
I'm mommy.
Hi,
Not
Noni.
Noni. I'm mommy.
Hi, Noni.
Oh my goodness. My child has picked up on my nickname, so now she's calling me that. So fun, baby. Don't make your nose yucky. It's yucky. It's yucky.
Milk. 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 I want milk.
All right, y'all. I'm going to head out for now, but I hope to see you real soon in the next one. Okay.